Welcome to the Health and Wealth Power Hour with industry expert and health insurance broker pro, Harlon Pickett. A show about how you can live longer with more cash and flexibility to really enjoy those years and never run out of money. Harlon will take your calls on a variety of topics related to health insurance, health care, retirement income planning, Social Security, thrift savings plan, 403B, 401k, or just about anything that gives you the tools to take action on keeping more dollars in your pocket and putting more dollars towards your retirement. He'll even share a few industry secrets if you listen close. And now, here's your host, Harlon Pickett.
All right, we are back. Health and Wealth Power Hour, episode number 5. Wow, let me tell you something. It has been a wild ride, and it's just going to get better. I think we will look back on today, April 1st of 2021, to truly see that this is the day that the health insurance industry changed forever. The reason for that is because of the American Rescue Plan Act that was signed back on March 11th. We're going to talk quite a bit about that today. Once again, remember, the name of the show is a Health and Wealth Power Hour. And today, because of the options that you now have with your health insurance and the way that the subsidies are now calculated, you can make it easier than ever to gain that wealth too. It is truly amazing what is possible now on the health insurance side through the marketplace. Now, I will tell you that I have not always been a big proponent of the marketplace. I believe that there is a lot better options out there in many cases. Most of us listening did not vote for this. We did not anticipate having this. But here's the bottom line. We're going to pay for it one way or the other. The $1.9 trillion that is been allocated for the entire bill, a big chunk of that is going towards the ACA, those tax credits / subsidies, and we're going to pay the bill for that. It's going to come. So whether you take advantage of it now or not, you're still going to have that bill. Obviously, this is my opinion, but I don't see how any other way it is going to happen. I'm going to talk a lot about what has transpired, what we have seen already today. I made sure that I was up super early this morning beginning to help people, letting them see what was available now. And I'm going to share a lot of that information with you today so you can see what you may be eligible for too. And that all started today. I even made I went ahead yesterday. I made this happen. I went and signed up somebody yesterday for an ACA plan so that I could compare what their tax credit subsidy, the money that they get to help pay for that plan was, how it looked yesterday compared to how it looked today. And we're going to talk about that. We're going to talk about that particular case, and we're going to talk about some amazing, amazing things that are happening out there. And you would be very remiss if you didn't at least take a look at it and try to help your family put more money aside and take advantage of better health insurance options. Looks like we already have a caller in, and we're going to go ahead and see what Chris has to ask us about today. Chris, how can I help you, sir?
Yeah, hey, Harlan. I just got one question. How do I find out if I get more money for my insurance?
Okay, great. Yes, sir. We're talking about that today, Chris. Here's the bottom line is everyone who is getting a tax credit now for their ACA plan is entitled to more money than they're getting at this time. And the way you would find out is by contacting us. I know that sounds funny, but it doesn't automatically happen. But if you'll contact us, we can run the numbers for you and tell you exactly what that would be. Once again, we do all this for absolutely free. It doesn't cost you anything for us to run those numbers for you and let you know what your new tax credit subsidy would be. Remember, that is what the tax credit subsidy is. It's the money that helps you pay for your plan. So it's going to lower the cost of your plan. And Chris, I don't know what kind of plan you have, but if it is appropriate, you could also change plans during this time. If what this tax credit, this money to help you pay for it does is lower your cost enough that it makes you eligible for a better plan than you have right now, then we can help you do that too. But if you'll reach out to us, Chris, the best way to reach us is at 512-559-4358. That's 512 559-4358 or at eaglecarehealth.com.
Okay, awesome. Thank you.
You're very welcome, sir. You have a blessed day and a happy Easter weekend.
You too.
All right. Yes, that is exactly what we want to talk about today, is what is possible with these new tax credits. The very first young lady that I helped this morning is Mary. Now, Mary's situation is she moved here from North Carolina. In North Carolina, she was paying a little over $1,000 a month for her plan. Mary is retired, makes about $55,000 a year as a retired person. That's her pension. That is her Social Security. That's all she gets is $55,000 a year. Now, in Mary's situation, she makes, before today anyway, she makes too much to get a tax credit. When she moved here, she was able to get a plan for a little bit less. Hey, she's saving a few dollars. Her plan was $935. And that is how much Mary was paying every single month until today. Because Mary at $55,000 was over the cliff. That's what we call it in the industry. She was over the cliff. She did not she made too much to get a tax credit. That cliff is about $50,000. So making $55,000, she was $5,000 too much. Now, because of the way they calculate the tax credit, which can only be at the maximum 8.5% of your income, it changed Mary's price for her insurance dramatically. Yesterday, Mary was paying $935 for her plan. Today, Mary is paying $323 for her plan. Same amount of money, same person, same county, same state, everything the same plan, but now she qualifies for a $612 tax credit. And so $935 to $323. Huge difference. Huge difference. Mary's plan happens to be an HSA. Mary happens to also be fighting cancer. Because of the cost of her plan, that $935, she could not afford to even put money in her HSA. With an extra $612, Mary now can take advantage of that HSA and have the tax benefits of that also. A huge deal. A huge impact in her life, saving her over $7,000 this year. It would be a shame for someone not to take advantage of that type of situation. She wasn't the only one to benefit. That is a very dramatic benefit, obviously, but Cindy benefited $111 a month, going from a $497 a month premium to $386. That is a three-person family making $85,000 a year. Mitchell is the one that I signed up yesterday. Her plan yesterday, $488. She qualified for a $467 tax credit. This is her and her husband, both of them in their 30s, $55,000. She was getting a tax credit of $467, made her plan $488. Today, her tax credit is $631, and she's paying $324. Interestingly enough, we have been talking about a dental and vision plan for her family, and she just wasn't sure if that was going to fit into the budget based on $488 cost for their health insurance. There's plenty of money now for them to get that dental and vision plan. These are the kind of things that are possible. These are the kind of things that we're going to discuss some more today. You've got to take action on this. Call us now, 512-559-4358, 512-559-4358, or eaglecarehealth.com. We'll be right back. All right. Yes, sir. It is a world of confusion out there in health insurance. You keep hearing all these things that are going on, and I'll tell you right now, there's only one way to get that clarity, and that is to work with someone who is not going to charge you a penny, but is going to make sure that you save all the pennies you possibly can. There has never been a better time to check into what is available for you because the savings are astronomical. One of the young ladies who is a caller, she actually texted us over at Eagle Care, wanted some more information. As I ran her information this morning, I was amazed to see what her savings was going to be. She currently pays for a very, very, in my opinion, poor Blue Cross Blue Shield plan. She's paying $529. We're going to be able to save her, if she stays on that plan, $450 a month. Just on that plan, I will recommend that she moves to something else, but ultimately it's going to be her decision. These are the type of things that are possible right now. It is absolutely incredible what you can get for a much lower cost than was ever possible. I believe we have a caller. Is that right, Gary? We have Denise on the line.
Hi, Harlan. First of all, thank you for doing this. I guess I kind of have a follow-up question to Chris's question, which is I'm still kind of confused about how this works for me. So does the extra money for my insurance just appear, or is there anything I have to do?
That is a great question. It would be awesome if it just appeared, right? That would make sense. Well, let me tell you, Denise, if it's something that makes sense, you can pretty much guarantee that the marketplace is not going to do it. No, ma'am, you're going to have to take action. Obviously, if you want to try to navigate that yourself, you are certainly free to do so. But as I have mentioned many times before, we will help you through that process absolutely free. It'll be very painless. Getting coverage is hard, and we do make it easy. But I would highly recommend that you just contact us. There's no obligation. We're not going to try to sell you anything. We're just going to make sure that you get exactly what you're entitled to and the tax credit, and make sure that you're enrolled in the plan that is best for you. Once again, if you didn't get it before there, Denise, the number to call is 512-559-4358. And I hope that I was clear on that. Once again, if you want to go out to healthcare.gov and try to do it yourself, you can certainly do so. But you have to take some action, whether it is doing it yourself or you reach out to us or another broker. Everyone should be able to help you, but no one should charge you anything for doing that, Denise. I just want to be clear on that. No one should ever charge you for helping you do this.
Thank you so much.
You are very welcome, ma'am. Once again, have a blessed Easter weekend.
You too. Bye-bye.
All right, thank you. All right, that is a great question, and it is the question that I have got asked a lot already today. A number of my clients have texted me this morning because I had been sending out emails and different notifications to let them know that this was happening. And, of course, because it has happened the way it has, we had no idea of what this was really going to look like. We had some idea percentages-wise what it may be, but I really severely underestimated it, to be quite honest. It was a lot more than I anticipated, and I think it's going to have a much bigger impact than I even anticipated now. But I have reached out to a number of my clients, let them know that you must take action, and we can help you. Really, the only information that we have to have, if you have an ACA plan, we're not going to go through and give you a million things you have to answer. If we know your name and your date of birth and your email address, we can help you out. We can get you set up on a better plan. We can give you new options, or we can just get you re-enrolled in your same plan at a lower rate. If you didn't qualify before, this is a big deal. Remember I told you about Mary. Mary didn't qualify before. Norbert and his family didn't qualify before. His family of four that makes over $100,000, they were paying $2,435 a month for their plan. Did not qualify for a tax credit. $2,435 a month, looking at around $30,000 a year for that plan. Now they qualify for a $1,369 tax credit. That's going to lower their plan down to $1,066. Norbert was a happy man this morning whenever I text him these numbers, as you can imagine. Huge difference in their life, but how does it happen whenever you don't have a marketplace plan or you're off market and we have to get you one now? The first step is to see if you're going to qualify for a tax credit. Most people will. Because they've removed that cap, most people will qualify for some type of tax credit. First thing we have to do is run those numbers. To run that, you have to contact us. You can go once again out to eaglecarehealth.com, or you can call us at 512-559-4358. That's the first step. You've got to have the information to find out, to make an educated decision, right? Make that educated decision. Even if you're on a plan outside of that, many of you may be on a short-term health plan, and you're on that short-term health plan because the plan that you looked at on the marketplace was not affordable because of no tax credit. Now is the time to take a second look. Now is the time to see if you may qualify now and get you a better plan than what you had before. Remember, the ACA plans, all of them, include preventative medicine at no cost. That's a big part of things that are missing in short-term plans. Now, I am a proponent of short-term plans. I think they have a great place, and I think in the past when people could not afford the crazy amounts of money, like I talked about Norbert's family having to pay $2,435 a month, that is insane. That is absolutely insane. But there's some health issues there that made them not eligible, I guess is the best way to say, for a short-term plan or maybe even a health share plan, which if you've been listening, you know I'm a big proponent of health share plans, and Eagle Care Health Solutions has a health share plan part of it. We do a lot of work with small businesses. We do a lot of work with individuals, getting them on the plans when they're appropriate. There's still money to be saved. Those are still excellent plans and excellent options. But with the passage of the American Rescue Plan Act, there are other doors that have opened. And we're here for you. We're here to make sure that you get the best plan at the best price, regardless of where that plan is. If it's still a short-term plan, then we're going to make sure that you have the short-term plan that works the best for you. If it's an ACA plan, we're going to make sure you get the best deal there. And if it's an Eagle Care Health Solutions unique plan, then we are going to be very happy to set you up on that also. A couple other examples of people that I helped this morning. Had a family of 4, husband and wife's in their 50s, $150,000 a year, 0 tax credit yesterday, $743 today. I know for a fact that that family is on an Eagle Care Health Solution plan. I know they are. Now we will look and see if that is still the best option. It may or may not be. But now is the time to compare. Maybe you're on a health share. Maybe you are on some other unique plan. Maybe you're on a limited benefits plan. Look at your card. If your card says limited benefits, take that to heart. It does mean limited benefits. I need you to be sure that you understand the options are unlimited right now. There will never be a better time for you to look at what your options are and to make the change that's best for you and for your family, and to save money to make sure that you get the actual health insurance plan that is best for you. Having the best health insurance plan many times can equate to getting the right health care for yourself, because, ladies and gentlemen, that is not the same thing. Health insurance and health care, no matter how much they have brainwashed us in this country, they do not equate to the same thing. Health insurance is one thing, health care is another. You do not have to have health insurance to get good health care. But if you want to know what your costs are before you walk in the door, many times people want to have those copays and know what their maximum out of pocket is going to be. Having an insurance plan over a health share provides one other thing that really makes people fundamentally more likely to get a health insurance plan. We understand this, and that is that you don't have to do anything. You give your card over, and the insurance company takes care of everything else. you do have a lot more work to do on your side. No, I say a lot more. That's not always true. You do have some work. You have to be an advocate for yourself when you're on a health share. And I like that myself. I think that's great because I think if you are an advocate for yourself, you're more likely to get the results that you're looking for. But you really have to have some skin in the game. And right now, the government's giving you an opportunity to get a great plan at a great price. And I believe you'd be remiss if you didn't at least take a look and see what's out there. Once again, reach out to us at eaglecarehealth.com or 512-559-4358. That's 512-559-4358. When we come back, I have a special guest that's going to tell us about some amazing things that FESA, our main sponsor, is doing over at the VA. Hang around. We'll be right back. Oh, yeah. Yes, sir. A little top, baby. Good deal. Welcome back. Health and Wealth Power Hour with your host, Harlon Pickett. Great to be with you today. Hope I haven't bored you to death with all this ACA stuff. You can tell that I'm a excited guy here about the changes that are going on because I just see the potential to help so many people. Before we move on and talk to Nicole, I wanted to point out something that I mentioned last week and make sure that you understood what's going on with C.O.B.R.A. Today also starts the possibility for people that have separated from service, not of their own accord. In other words, they were involuntarily separated from service from a company that offered C.O.B.R.A., or they lost hours and therefore they were no longer considered full-time employees, and therefore they were eligible for C.O.B.R.A. from a company that offers C.O.B.R.A. That's a big caveat right there, because if you worked for a small 5-person company, they do not have to offer C.O.B.R.A. So if your company offered C.O.B.R.A. and you are now eligible for it, even if it was a year ago that you were eligible for it, you now can get 6 months of free C.O.B.R.A. And your employer or the administrator of that C.O.B.R.A. plan is responsible for getting that information to you. And that's a pretty big deal. That is a lot of money that C.O.B.R.A. cost, and getting it 100% subsidized can make a huge difference as you look for that new work. If you have any questions about that, certainly reach out to us and we can answer all those questions. 512-559-4358 or eaglecarehealth.com. All right, we are very blessed today to have with us Miss Nicole Stanley. She is with FESA and has been doing some amazing things really all across the country. They were over in Louisiana during all of the hurricanes, one after another. I believe there was like 5 in a row or something, wasn't there, Nicole? I don't know, some crazy number of hurricanes that came through there, and they just kept going back and making sure that people had the basic necessities that they needed. And I believe she's here to talk to us today about some of the stuff going on with the VA. Welcome, Nicole.
Well, thank you for having us, Harlan. We appreciate it. You're doing a great job and getting a lot of great information out.
Thank you very much. Awesome. That is great. So tell us what you have going on. I believe it's next week, right?
Yep. Next week, we're going to, of course, this week was Easter week, so we just kind of pushed it back a week just to kind of be able to honor this week. But we're going to be honoring case managers at the VA hospital, and all the case managers and social workers are basically working from home. They probably do an extreme skeletal crew at the hospital, but they're all, navigating and negotiating just like a lot of us are
right
out there, especially the small to middle sized businesses are doing. And we're going to be feeding all of them.
Okay.
Now, we did this we've done it about 4 times this year. Christmas, right when COVID hit, and we fed the whole hospital. And so
wow.
We're going for it again. They're going to get some great Damaris barbecue and get some sausage and some brisket, which we won't turn away, will we, Harlan?
There you go. Never. That's correct.
Yeah, Texas girl never turns away brisket, ever.
There you go.
So anyway, but yeah, it's the VA is just an amazing thing. Obviously, they're offering drive-through vaccine lines, Fisher House at the satellite VA locations, and then also at the hospital. But I think I will never forget Christmas Eve driving up, and it just looked like a mass unit. There are tents completely surrounded the hospital, and these guys were working really long hours about that time, and anything that we can do for our vets and those who support our vets, we need to be in there for them. So, you know.
That is great. It's amazing how we never hear the positives about that, right? All we ever hear is the bad things the VA has done, the situation where someone had something go wrong, and there's no doubt that should be a concern. But the good things that they do, I think, are so overlooked. The care that they give for our veterans, as a regular instance, I believe is very good. Most of the veterans I know have received excellent care from the VA. And while, yes, you do hear the stories of someone getting lost in the cracks somehow, some way, that can happen anywhere, not just at the VA. But I applaud you in particular and FESA in general for really making this happen and really getting out there and recognizing the people that are putting a lot of work in. Those caseworkers, it didn't, just because they're not there doesn't mean that their job got any easier. In fact, I would imagine it got tougher. What are some of the stories you've heard from some of them?
Well, I mean, you know, we started off in February of last year really supporting, knowing that the VAs, and we're talking New Orleans, San Antonio, Walter Reed, et cetera, that they were going to be needing some extra help, especially on the PPE side. You know, I believe we gave over 100,000 masks the first February and March.
Wow.
Of PPE, and that was regulated, medical grade regulated masks. But,
right, and that was almost impossible to get that stuff at that time, and FESA was able to make that happen, huh?
We did.
Wow.
It was coordinated through a company in South Carolina that was actually made jeans for like Abercrombie and Fitch and for Levi, and they converted over, and we just happened to be at the right place at the right time. And I knew a gentleman from my old past life from the Masters, and next thing he's a member of Augusta Country Club, and next thing you know, we've got masks, and then we've got hand sanitizer from Dr. Bright's, and which is also medical grade. So everything that we did was, first class.
That's incredible. It's funny. I like the thing. You were at the right place at the right time. Do you know you're never at the right place at the right time unless you're paying attention? If you're not looking. And I know you were, and I know FESA was, because FESA's motto is service first, regardless of whether that's helping somebody retire or providing service out in the community. And that's what you were doing, is you were looking out there saying, how can we help? Look at what's happening. Look at these places that our veterans are relying on, and there's tents in the parking lot. They can't get simple things that you would think. Now, we know better now. A year later, we've learned, right? But simple things like PPE. Who would have thought that PPE would have been such a commodity that, I know we all saw the silly memes with people with masks or with hand sanitizer sitting at the poker table stacked up instead of with chips or something. What an amazing thing that FESA was there, that you had the forethought and to be in the right place at the right time because you wanted to be. You were looking. So I really commend you guys for that. And so as you've gone through this, you helped with the veterans, you worked with the folks over in Louisiana, you've been to these different hospitals. What is the attitude of these folks? What is there an appreciation, or is there a dumbfoundedness that they can't believe you're there?
I can only say just great gratitude. I mean, we fed them, obviously. I mean, like I said, you show up with food, and because here's the other thing is the cafeterias were closed. I mean, I think it wasn't until probably early fall that they opened up the Starbucks within there, and that was it. So, and you're talking, these people were working sometimes 18-hour days. So unless you brought food in, it was not going to be getting to them. So it was the gratitude, and then also just knowing that somebody was there to listen. And, once again, all of those special things, just like yourself, FESA, at Eagle Care, the first, initiative is to listen, because we will never know what you need unless we listen.
Right.
And so that's really important, and that's what we try to do. And then that way we know exactly we're the triage.
Right.
And so
That's great. That is great, Nicole. All right, we have a caller, Nicole, and I'm going to put you on hold because you mentioned to me a minute ago that you had a question about something else that didn't have to do with this. So I'm going to let you ask me that question once we talk to Rich.
You got
Rich
it.
is on the line right now. Rich, how can I help you, sir?
You can help me, I think. I appreciate you taking my call.
Yes, sir.
So I've been listening to your program, and I went on and tried to look to see if I was qualified for these new medical insurance tax credits. And it asks you for what your income is going to be for the year.
Right.
And I'm in a situation where I'm mainly commission-based, and my income really fluctuates from year to year, depending on what month it is and what's going on with the economy and whatnot. So I'm wondering what happens if I underestimate or overestimate what I think my salary is going to be in 21, and do I have to pay them back if I do it one way, or do I get a credit? How does that work? Do you know that?
Yeah, hey, that's a very, very good question, Rich, and I'll tell you, that has always been a concern. I don't know that too many of us have a crystal ball when you're in a commission-based job, right? You hope you're too high, right? You're saying, okay, I'm saying I'm gonna make 100, but I sure hope it's 2. Whatever that happens to be, you hope that you're wrong on the other side. And then if you're getting a tax credit, you don't know for sure if you really want to be wrong. You're like, wait a second, they just gave me $6,000-$7,000 to help me pay for my insurance. I really don't want to give that back to Uncle Sam.
Exactly.
And so I understand completely what you're talking about, Rich. And let me tell you, one of the ladies that I talked to this morning is in that exact situation. She just found out that, yes, she made too much money last year, and she's going to have to pay $6,000 back on her taxes because she did not estimate enough on her income for last year. That is not a very happy thing to find out from your CPA. But the real answer to your question is, because of this change, and it based now on your percentage of your income, it's a little bit more flexible. Before, they used to have the cliff. If you heard me talking about that earlier, you reached that cliff and you just fell off. You no longer qualified for anything. Now, since it's a percentage, then you're going to qualify for something. Yes, there is a point where you can get so far off that you wouldn't. But if you said you thought you were going to make $100,000 and you made $200,000, it's really shame on you for not getting back in touch with your broker or handling it yourself and getting on the site and changing your income, because that is what determines what your tax credit is. What do you anticipate making? And yes, that is very difficult for someone on a commission-based job to figure that out. But it's also really your responsibility to make sure you're updating your broker, or if you're handling it yourself, make sure that you're updating your application throughout the year so that your tax credit can be adjusted. That's a huge deal. And
okay,
Rich,
so it'll be adjusted throughout the year if I went in there and changed it.
If you went and changed it, right? How would they know what you make, Rich? If you don't go in and change it, or you don't contact us or your broker to change that, there's no way they could know what's happening. You're going to get the same tax credit throughout the year unless you go and change it and they reduce it. Now, the other part of that question is, what if you don't do high enough? What if you said, hey, I'm going to make $200,000 and something like a pandemic happens, right? And then all of a sudden,
right.
you can't get out, you can't see people, you can't do whatever it was. You happen to be in an industry that's severely impacted by it. And now instead of making that $200,000, you made $100,000. Well, if you were still on a marketplace plan and you didn't qualify for that tax credit, but you were on a marketplace plan, then you will get that tax credit later. So you will get it on your taxes. Now, it does not apply if you're not on a marketplace plan. If you're on a short-term plan or you're on something else, you don't get that tax credit. You were eligible for it, but you don't get it. You have to have been on a marketplace plan. Let's for instance say that you said you were going to make that $200,000. You qualified for a $300 a month tax credit. You ended up making $120,000 instead, and now you would have qualified for a $700 tax credit. Then that $4,800 that you would have been eligible for will be a tax credit, just like it sounds. Also, we call it a subsidy. Those funds that help you pay for your plan, if you didn't use them, they come back to you on your taxes for, in this case, 2021.
Oh, okay, perfect. And I'm not worried about it too much, and I can adjust on the way, and I'll probably be looking for you guys to help me with this.
All right, that's great, Rich. I appreciate that. Once again, you can reach out to us, buddy, on eaglecarehealth.com or 512-559-4358. I appreciate you calling in today, Rich.
Yep, thank you, Harlan.
Yes, sir. All right. When we come back, we're going to find out what Nicole is going to ask us. I'm a little on the terrified side right now because there's no telling what kind of question she's going to have for me. Probably going to be a very difficult one, knowing her.
It's April Fool's.
Oh, no, I didn't even think about that. And it's April Fool's Day. Oh, my goodness, I'm in big trouble. All right, gang, we'll be right back. Health and Wealth Power Hour. Harlon Pickett coming back at you. All right, a little bit of Phil Collins getting us started off for this last segment of the show. We are here with Nicole Stanley of FESA, telling us what a wonderful, wonderful job they're doing out in the community, helping folks. Going to be going out and feeding some of the folks over at the VA next week. And that is very, very impressive. Take care of the folks that take care of our veterans. Wow. That's a big, big deal. Certainly, once again, commend you guys over there, Nicole. That is a really, really great thing to do.
Thanks.
All right. So you said you had a question for me. I am kind of scared here, but what you got for me, Nicole?
How did the cactus get across the road, Harlan?
Oh, my gosh.
It's April Fool's. Got to do something here, buddy.
How did the cactus get across the road? I don't know. Got hit by a truck or something? I don't know. What?
No. It's not a deer, Harlan. It's a cactus.
It's a cactus. Oh, maybe it did get hit by a truck and got carried or got knocked across the road or something. You know?
No. It was stuck to the chicken.
Oh, my gosh.
Yeah. No. All kidding aside, seriously, my question is pretty important because, you talked about the VA, and a lot of people don't necessarily equate federal employees being what they call non-career, where they have to make decisions like what you were talking about in the segments prior to this. And then, we've also got that small to mid-size, business with their workforce that, are having to make decisions too. We found that some of them have the 1099 employees, some of them don't. Tell me a little bit, if, you were to help us help them, how you would guide that.
Okay, that's a very interesting question. One of the things that we developed Eagle Care Health Solutions for is for that non-career federal employee. A lot of folks don't realize that there are hundreds of thousands of federal employees across the country that do not receive any benefits. They are 1099 government contractors, and they get no benefits whatsoever. And Eagle Care Health Solutions was actually designed for those individuals.
Yeah, I mean, that was the thing that we noticed, in our side of what we call business development is, when we went out to service, the VA, Postal, Homeland Security, even, believe it or not, Secret Service.
Sure.
We would discover that some of them were uninsured just because of what you were talking about. They were too high on that tax bracket.
Yep.
Didn't get the credit or got a minimal amount. And just like even the guy that you talked to this morning, it sounded like he made $100,000 and then $30,000 of a third of his income is going to,
paying for health insurance.
Yep. Plus he's paying taxes.
Right.
And we know that's a little scary coming up because it may be going up.
Right.
Well,
this has got to be paid for, right? We talked about that earlier. This has got to be paid for. $1.9 trillion didn't just appear. There wasn't a genie somewhere that said, I'm going to make this money and it's just going to be there. No, that money is coming from somewhere, and that is going to be our taxes over time. That's going to be us. That's going to be our kids. That's going to be our grandchildren. That's going to be here for a long time. And as I mentioned before, Nicole, whether you take advantage of this situation and get the tax credits and the subsidies that you're eligible for, or you don't, the bill's still going to come due. You're still going to pay for it. That money's already been allocated, is my point. That money's already been spent, as it were. That money is there for you to use, and that's why I recommend folks do it. To answer your question specifically about those non-career federal employees, Just as Eagle Care Health Solutions has always been a good option for them, it still is, but here's the caveat. They may now qualify for a tax credit, and it could be a better option for them to get an ACA plan. Not everybody will be in that situation, but we need to talk to them and find out. As we have talked about multiple times, there is no cost for us to consult with you and find your best option. And so those folks truly need to reach out to us so that we can look at their situation and make sure we give them the best options for themselves. And once again, EagleCareHealth.com or 512-559-4358. The second part of your question was about those small to mid-sized businesses. Most of those businesses we look at are going to be less than 50 employees. We certainly can help more than that, but the ones that don't have to provide that insurance. And so if you have 50 or more full-time employees, then you have to provide insurance. But if you have less than that, it's up to you. And many of those businesses want to provide something because that helps them attract and keep good employees. Very, very important. We've talked on the show before about how many small mom and pops get this person right out of trade school, or they get this guy right out of high school, train him up, man, get him to where he does things just the way that they need to. All of a sudden, he finds somebody, finds the love of his life, gets married, they're going to have a child. Now he has to have benefits. Away he goes to the big employer. And they've spent all this time and effort to get this guy trained up, and now they got to start over again. And so many of those businesses could offer a plan or could offer some benefits, and they just don't know it. They just don't realize how affordable options like Eagle Care Health Solutions can be. Or even having someone explain to their employee what options they have on the ACA. The person may not even know. It may be in their best interest to help that person pay for that with something like a wellness bonus that allows for them to use that money to pay for those things. Lots of different unique ways that you can do things like that. But today's world is, let's look at the pandemic. Let's look and see what happened there and think of how many of those people were not covered. And now you look at 10 million more that lost their jobs, and how many of those don't have any coverage now either. There is a huge need for Eagle Care Health Solutions, both unique solutions and the help with the ACA. And while we haven't talked a lot about the ACA instead of the last 2 weeks, that's just one of the things that we really do. Because as we were working towards helping more businesses with those unique solutions that Eagle Care Health Solutions have, that's really where our focus has been. But due to the change, due to the American Rescue Plan Act, we've switched our focus because there are millions of people across the country now that can have their life changed by having a less expensive health plan with better coverage, and now even an opportunity to save money where they may not have been before. Remember the young lady I talked about earlier? First person that I helped, 5 o'clock this morning. $935, all the way down to $323 a month. She now has $600 a month in income or in money that she can use for something that she didn't have before.
Well, she can bring it over to FESA. We'll be happy to make it more money for her.
All right. Hey, I appreciate everyone joining in today. Please join with us again next week. Once again, if you want to reach us at Eagle Care Health Solutions, that is 512-559-4358 or EagleCareHealth.com. Thanks again. See you next week. Harlon Pickett, Health and Wealth Power Hour. We're out.